Hello everyone, I'm Yin Hao, student number P121480, majoring in educational psychology. The main topic of today's presentation is case study methodology in qualitative research. Before I begin, I would like to introduce you to the main content of this presentation. Firstly, I would like to give you a detailed introduction to the case study method, including its definition, characteristics, and use. After this, I will start with a paper that uses the case study method, and by presenting how it was used and the final results, I hope to give you a deeper understanding of the case study method as one of the qualitative research methods. The report begins now. So let's start with the method itself. About the case study, I will introduce it in 6 dimensions. Let's see a brief summary first. These 6 dimensions are the definition of the case method, his 4 important characteristics, his 6 types, the 6 data collection methods of the case study, and the 5 data calculation methods. Of course, for students who want to understand the case study in depth after the class, I have likewise prepared for you. I have also prepared a few good reference books for you. Let's look at the definition of a case study. So let's see its definition. A case study is an in-depth study of one person, group, or event. In a case study, nearly every aspect of the subject's life and history is analyzed to seek patterns and the causes of behavior. Case studies can be used in various fields, including psychology, medicine, education, anthropology, political science, and social work. Since this is a research method that allows the researcher to gain more in-depth information, many of its characteristics are also apparent. Let's together see it. First, it allows researchers to investigate things that are often difficult to impossible to replicate in a lab. Second, it allows researchers to collect a great deal of information. Then, it also gives researchers the chance to collect information on rare or unusual cases. Last but not least, it also permits researchers to develop hypotheses that can be explored in experimental research. As we have just said, case studies can focus on either one subject or multiple subjects, so different choices lead to different directions, and different directions means that there are different kinds of case studies. The first is collective case studies. These involve studying a group of individuals. Researchers might study a group of people in a certain setting or look at an entire community. The second one is descriptive case studies. This involves starting with a descriptive theory. The subjects are then observed, and the information gathered is compared to the pre-existing theory. The third one is explanatory case studies. These are often used to do casual investigations. In other words, researchers are interested in looking at the factors that may have caused certain things to occur. The fourth one is exploratory case studies. These are sometimes used as a prelude to further more in-depth research. This allows researchers to gather more information before developing their research questions and hypotheses. And then it's the instrumental case studies. These occur when the individual or group allows researchers to understand more than what is initially obvious to observers. The last one is intrinsic case studies. This type of case study is when the researcher has a personal interest in the case. All in all, the 3 main case study types often used are intrinsic, instrumental, and collective. Intrinsic case studies are useful for learning about unique cases. Instrumental case studies help look at an individual to learn more about a broader issue. A collective case study can be useful for looking at several cases simultaneously. But as for me, the personal opinion as a psychology student, the type of a case study that psychology researchers utilize depends on the unique characteristics of the situation as well as the case itself. As a young researcher, whether quantitative or qualitative, data is naturally essential in order to be able to substantiate your research hypothesis. Of course, even as a member of the family of qualitative research methods, the focus of testing hypothesis results is certainly not on various figures. So how do you get the data you need in a case study, and how do you use the data collected to prove the hypothesis? Let's look at it together. First, let's talk about the data collection method. It's 6 points. The first is archival records. Census records, survey records, and the name list are examples of archival records. The second is direct observation. This strategy involves observing the subject, often in a natural setting. While an individual observer is sometimes used, it is more common to utilize a group of observers. The third is documents. Letters, newspaper articles, and administrative records, etc., are the types of documents often used as sources. And it's the interviews. Interviews are one of the most important methods for gathering information in case studies. An interview can involve structured survey questions or more open-ended questions. Then we talked about participant observation. When the researcher serves as a participant in events and observes that actions and outcomes, it is called participant observation. The last one is physical artifacts, tools, objects, instruments, and other artifacts are often observed during the direct observation of the subject. And then let's see the data analysis method. Well, as for me, even we talked about this data analysis method, but as a qualitative research, this method is more objective, but it can also divide it into 5 methods. Let's see it one by one. The first one is personal diagnosis. It means provide your diagnosis and give the appropriate diagnostic and statistical manual code. Explain how you reach your diagnosis and how the client symptoms fit the diagnostic criteria for the disorders. Okay, let's continue to see the data analysis method. It contains 5 points, so I will introduce it briefly. The first is personal diagnosis. It means provide your diagnosis and then give the appropriate diagnostic and statistical manual code. The second one is cognitive behavioral approach. It means you should explain how a cognitive behavioral therapist would approach the treatment. And the third one is humanistic approach. It tells us to describe a humanistic approach that could be used to treat your client, such as client-centered therapy, provide information on the type of treatment you choose, the client's reaction to the treatment, and the end result of this approach. Then you can explain why the treatment was successful or unsuccessful. The fourth one is psychoanalytic approach. It means describe how a psychoanalytic therapist would view a client's problem. Provide some background on the psychoanalytic approach and cite relevant reference. Explain how a psychoanalytic therapy would be used to treat the client and how the client would respond to therapy and the effectiveness of treatment of this treatment approach. The last one is pharmacological approach. If treatment primarily involves the use of medications, well, I think this medications contains is very large. Explain which medications were used and why. Provide background on the effectiveness of these medications and how Monotherapy may compare with an approach that combines medications with therapy or other treatments. After the main points of the case study method itself, let's look at an article on the use of the case study method to help you deepen your understanding of case studies. This is a psychological test entitled Health Psychological Case Study of High Intensity, Low Impact Physical Training Program, written by Stephen D. Edwards. I'll start with the abstract purpose of the study, research questions and conclusions, subject information, sampling methods, data collection, and the computational methods to explain it to you. And let's see it. Let's start with a general discussion of the article's abstract. So, generally speaking, this case study reports on health psychological evaluation of an integrated, high-intensity, low-impact physical training program for a 32 years old male accountancy teacher. The combined findings highlighted the importance of a physical training program based on the client's personal preferences. The client reported finding the program enjoyable, flexible, invigorating, and easily adaptable to the needs of a variety of individuals facing time and space constraints in their daily lives. With minimal innovation for greater complexity, control, and challenge, such programs may easily produce an enjoyable process experience. Next, we look at the article's research objective question. Let's see, we have one objective and two research questions. First, let's talk about the objective. It's to evaluate the health psychological effects of a high-intensity, low-impact training program. Well, the first question is, what particular health psychologically oriented exercise program would be valuable for this particular client? And the second is, what particular components would be most suitable? And this article uses judgmental sampling to select one subject. And who is the participant? The participant is an accounting teacher at a local private education college wanted to develop a plan to improve his health, stress tolerance, and emotional state based on physical characteristics and condition. Because his right knee was injured as a result of his running programming, and he is often different height and weight to the physiology of his right foot. First, I want to talk about validity and reliability. It is a combination of measurement questionnaires with high reliability and validity was firstly, and secondly also ethical approval was obtained from universities and private clinics and informed written consent was obtained from clients. And for this part, the data collection method and the data analysis method, and I want to describe it more specific and let's see next page. So to talk about the data collection method we used, it's a mixed method of qualitative research. And it contains the single person individual method. Well, it's subject to self-assessment and briefing. And we use questionnaire measurement methods too. And to talk about the data analysis method we used, it's qualitative data were analyzed using the SPSS, with specific reference to descriptive, non-parametric statistics for the psychophysiological and psychometric measures. The qualitative study collected the subject's subjective experience and feelings about the project using a combination of interview method, data and analysis. Well, because our process name is qualitative research, so I think the next 10 I should focus more on qualitative part. So let's see the question's content. The high intensity part components include interval cycling, limited 1970 and an adapted version of the Canadian Air Force 5BX exercises. And the low-intensity components include Pilates balls, like Zanzibar technique for postural issues, and Qigong for movement awareness, core strength, and flexibility. A typical weekly program includes steady station bike rides, interspersed with all first running exercises, along or in low impact form of Pilates are performed in different partings, usually along or after the high intensity portion of the workout. So we also use the interview method. Qualitative findings were made as to whether the subject's perceptions of the effectiveness and the reasonableness of the practice programming sightings were in line with assumptions and our adaptation, and the validity of the qualitative research method was further corroborated using subsequent quantitative research methods. So we talk about the quantitative research method. Let's see it. This part, the data collection method, we can see it can be divided into 5 parts. So let's see the first one. The current pre and post text study design includes parallel and convergent design principles for the collection of quantitative and qualitative data in the form of psychometric tests and qualitative empirical description. Then quantitative data includes psychophysiological readings on the heart mass in Wave 2 device, supplemented by responses to psychometric measures of health, resilience, and mood in the pre and post test phases. And then qualitative data includes descriptions of experiences recorded period to testing, a diary of the client's experiences during the counseling process, and an assessment of the result of the post-test phase 3 months after program. As is typical of studies, the communication, relationship, and the program variables form the larger element of research intervention necessary and sufficient. And the quantitative data were analyzed using tests with descriptive, non-parametric statistics for psychophysiological and psychometric measures. So, all in all, the article provides comprehensive quantitative, qualitative, empirical, and evaluated evidence of an effective short-term health psychology case study that includes both high-intensity training performance. As noted by the programming can be adapted to the needs of a variety of individuals who face time and space constraints in their daily lives. In addition to exercise adherence, sustainability, and the minimal risk of injury, such programs tend to be highly effective as they are adaptive, inherently enjoyable, and rewarding. By minimizing the need for clients and coaches to adapt to greater complexity, control skills, and challenges, they can actually guarantee an enjoyable and meaningful. And let's see the summary of the research. Well, I want to ask you, still remember the questions we talked about a few minutes ago? Versus what particular health psychologically oriented exercise program would be variable? This particular, you can see the second question. Can, of course, so thank you, guys, thank you, my teacher and my classmates. That's all. That's my present. Thank you very much.